Hello, and welcome to Riverside's Breast Cancer Awareness Month speaker series. Riverside is pleased to present a new community talk on a different breast cancer topic each Wednesday this month at noon. A breast cancer diagnosis at any age is difficult, and while the risk of breast cancer is much higher in older women, younger women may develop breast cancer. Breast cancer in younger women is more likely to be fast-growing, detected at later stages, and can be more challenging to treat. Today's talk is presented by Dr. Ilene Stephan, an internal medicine physician in our Riverside Cancer Care Network. Dr. Stephan will share with us the unique challenges that younger women with breast cancer face and why early detection and knowing risk factors is such a valuable tool. Dr. Stephan?
Hi, it's October, it's Breast Cancer Awareness Month, and I'm here today to talk about the topic of breast cancer in young women. About 11% of all breast cancer cases in the United States are discovered in women younger than age 45, and breast cancer is the leading cause of cancer death in women ages 20 to 39. This 11% number equates to about 26,000 young women per year dealing with this diagnosis. And in developed countries in recent years, the incidence of breast cancer in premenopausal women has been on the rise. So one of the issues in younger women who are diagnosed with breast cancer is that it is more likely to be an aggressive variant. So not all breast cancers are equal. There are multiple molecular variants, and some are faster growing and higher grade and have a higher propensity for both recurrence and spread. Hormone receptor negative disease is one such variant that is more common in women who are younger and premenopausal. This is an aggressive variant that has lower survival rates, and it's more challenging to treat because it does not respond to the therapies that we use for breast cancer that is hormone receptor positive. So this seems intuitive, but it's true for all women. The earlier breast cancer is found, the easier it is to treat and the easier it is to recover from. So it's really important for women, and particularly young women, to advocate for their own health. Part of that is knowing what's normal for your own breasts. So we call this breast self-awareness now, rather than breast self-examination. And the principle of breast self-awareness is to know what is normal for your breasts and if something has changed, to seek evaluation. So more than half of breast cancers in premenopausal women are self-detected, and that's really important. You know, most women in this age group are not yet undergoing routine mammograms. So it is important that if you find something that is new or seems different to you, to talk with your healthcare provider. It's also important to know your risk factors, and one such risk factor is family history. It is important, particularly if you have a first-degree relative, to realize that your breast cancer risk is increased by as much as 1.5 times. If you have 2 first-degree relatives, it could be 2 to 4 times increased risk. And the younger those first-degree relatives are, the greater the risk. So if, you should know your first-degree relatives are parents, siblings, and children. Some of the other risk factors are onset of menses before age 11. In young women, pregnancy, around the time of pregnancy, is a higher risk time for development of breast cancer. Dense breast tissue is a risk factor. And there are some risk factors that patients can modify themselves. So increased alcohol consumption, 2 to 3 drinks a day, increases your breast cancer risk by about 20%. And lack of physical activity also carries an increased risk. We do recommend clinical breast exams by a trained clinician beginning at age 21. That's typically every 3 years unless you are at higher risk, in which case it may be more frequent. And then for average risk patients, screening mammograms are recommended beginning at age 40. If you believe that you could be a higher risk patient, it's important to discuss that with your healthcare provider because it may change your screening strategy. So that's something important to consider. There are some unique challenges that young breast cancer patients face. This is a time in life where women are working on careers and families, and all of that's impacted by this diagnosis. And some of the primary considerations for young women are fertility considerations. So many of the treatments that are used for breast cancer impact ovarian function and future fertility. And it's really important for young women to consider that before they start treatment. Cryopreservation of eggs is an option, but that option has to be considered before therapy. And it's a lot to digest all at one time after you've been diagnosed, and in some instances can delay initiation of treatment. Once breast cancer has been treated, the initial treatment, many young women who have estrogen receptor positive disease are on endocrine therapies for sometimes as much as 5 to 10 years. And when to consider pregnancy becomes a major decision point for them. The timing of pregnancy, can that therapy be interrupted for a brief time to pursue a pregnancy? So these are all issues that young women with breast cancer in particular deal with. And if they do become pregnant, then resuming therapy, that impacts breastfeeding, their ability to nurse their children. Are they able to do that? Making those decisions is sometimes really difficult. And these are all decisions unique to young women with breast cancer. The same treatments also can cause early menopause, both chemotherapy and then sometimes ovarian suppression as a part of their treatment will cause menopausal symptoms. So hot flashes, vaginal dryness, and sexual dysfunction, mood changes, accelerated bone loss are all symptoms that these women deal with. And then the long-term effects of treatment. So women who have treatment for breast cancer at an early age, sometimes for a lifetime, are dealing with long-term impacts, including lymphedema, loss of bone density, cardiovascular issues, and neuropathy, just to name a few. So with all of these challenges, we do have excellent resources to help young women. At Riverside, we have a breast cancer navigator who is a nurse dedicated to supporting our patients from the time of diagnosis and through treatment. Also during treatment, there are other resources, including nutritional counseling, a cancer wellness program, a lymphedema clinic, and breast cancer support groups, to name a few. We are also fortunate in our community to have an excellent organization called Here for the Girls, which really focuses on supporting and educating young women who have been diagnosed with breast cancer and are dealing with the impact of that. So that is an excellent resource as well. So I would encourage all young women out there to know your risk factors. If you feel that you are at high risk, talk with your healthcare provider and be advocates for your own health.
Thank you, Dr. Stephan, for the valuable information you shared today. Women who develop breast cancer younger than 40 years old, the age when screening mammograms are recommended for those at average risk, may have their breast cancer undetected, then diagnosed at later stages. Knowing what is normal for how your breasts look and feel, alerting your healthcare provider to any changes, and having a clinical breast exam starting at 21 years old is so important. We encourage you to discuss your risk factors, such as family history, with your healthcare provider, who may recommend an earlier screening strategy. Riverside invites you to share this information with your friends and family. Together, we can make a difference. I hope everyone enjoyed today's presentation and invite you to a new breast cancer awareness talk each Wednesday this month at noon. Have a good afternoon.